killing more than 50,000 people, injuring 100,000 others across both countries. And in the aftermath of the quake, nations and aid organisations mobilised swiftly. We heard from Turkey an hour ago. We're going to hear from Syria now. You may remember a year ago we spoke to Father Tony Riordan of the Jesuit service, who lives in Aleppo in northern Syria and who helped lead the response there to help about 1,000 families who'd been forced to leave their homes. And Father Tony is on the line now. Welcome back to Newsday. Just remind us how badly affected Aleppo was by the earthquake when it was already dealing with more than a decade of civil war, which led to the city being almost totally destroyed anyway.
Absolutely. Good morning, Rob. So when the earthquake hit here just over a year ago, one of the significant impacts, apart from the collapsing buildings and the killing of thousands of people, was the impact on the psychological state of people, because the earthquake was citywide and it shattered the sense of safety. So this added to the compound state of people after 12 years of the civil war. And it displaced thousands of people. Over 50,000 people had to leave their homes. The majority of those have now returned, but there are still a significant number of people whose shelter situation is very, very dire, in the context of a continuing deterioration of the life conditions of people here: access to food, access to healthcare, access to income. All of these things have deteriorated. So the aid we have been delivering in response to the earthquake has been done on a treadmill of a worsening situation. So the people of Aleppo find themselves in a worse situation, I'm afraid, 1 year on, and in a context as well where the funds for humanitarian work is shrinking as the needs surge. The available resources, unfortunately, are shrinking.
So what is it like for people who've stayed in Aleppo? What is daily life like there?
It's a struggle, the struggle for survival, not knowing whether they will have enough food today. Sometimes mothers are faced with, do they feed their children or do they get the needed medicine to heal them, often denying themselves either food or medicine for themselves. Wondering what tomorrow will bring. The mentality is that things continue to get worse. So people are under a lot of strain, and this is why our creation of safe spaces and psychological interventions are so important, to try and maintain resilience and positive coping mechanisms. People are also living, of course, in the dark at nighttime because of the inadequacy of electricity. Most people live with 1 or 2 hours a day. So hunger, darkness, despair, these are the daily realities of thousands of people in Aleppo.
And what help are you able to provide people? And I just wonder if you can put that in the context of what the Syrian state is able to provide.
So we have been able to provide food to about 50,000 people over the last 12 months in several rounds of food aid, and this is a very important support. Also providing access to healthcare. I remember one woman who told me recently that in her health clinic, that had she to pay for the antibiotic that she was able to access in our clinic for free, had she to pay for that, it would cost her about half her monthly income. And we've also, I think, very importantly, been able to provide mental health supports. This, while the earthquake was a physical disaster, it was also a mental health disaster. And I think ourselves and other organizations have been able to intervene in a pretty effective way to support the natural resilience of people. So most of the aid seems to be delivered by small organizations and NGO sector organizations like ourselves. And it's so important, I guess, that we can continue, as we're present on the ground, that we're enabled with the resources to continue this work as the situation gets worse.
You've painted a very bleak picture of what life is like in Aleppo. Do people there have hope that one day Aleppo will be a functioning, livable city again?
I think very few people hold that as an immediate possibility. So many people are looking for an exit route, and I think there will be an increase in outward flow of people. Anyone who is young and able are looking at all sorts of options of leaving the country, moving to the region, or moving to Europe, and in most cases these are illegal, or they're not easily accessible exit routes.
All right,
So I
Tony,
think
we've
it's
got to leave it there, but thanks so much. It's good to talk to you again a year on. Father Tony O'Riordan there from the Jesuit service, live on the line from Aleppo in Syria.
This is the BBC.